My name is Dr. Deborah Wilson, and I'm here to talk to you about MonaLisa Touch Vaginal Laser. So to give you some background, when a woman becomes menopausal, the average age is about 50, her ovaries make less and less hormone, less and less estrogen, less and less testosterone during the 40s, but around age 50, the ovaries really stop making any significant amounts of hormone. And the vaginal epithelium is very dependent on estrogen, particularly, to maintain its thickness, its distensibility, its elasticity, its moisture, its ground substance. So once a woman becomes menopausal, the vaginal epithelium will tend to really thin. It'll become more fragile and vulnerable to any kind of pressure or stretching. So this becomes a serious problem for many women. Now, if a woman has the ability to take estrogen, to supplement herself with estrogen in the postmenopausal years, then we can usually reverse most of that process. But if she can't take estrogen, if she's had breast cancer, if she has a clotting defect, or she just doesn't want to take estrogen because it scares her and she doesn't like to take things, we're stuck with this problem, which can become a very significant problem in a relationship, because men do not lose their sex drive at age 50. Maybe their sex drive starts to diminish at age 65 or 70. It's variable, but so you have a couple, they're going along, they have a great sex life, they have a great relationship, and then all of a sudden the woman hits into menopause and the vagina becomes kind of tight and dry, and intercourse becomes very uncomfortable for her. So uncomfortable that she wants to avoid it. We're human beings, we avoid pain, so that's normal. So what do we do with a woman like this? Well, up until a few years ago, there was nothing to do, quite frankly. We could suggest lubricants, we could suggest dilators, but none of them really work to increase the elasticity and the thickness and the fluffiness of the vaginal epithelium. But at this point, we have MonaLisa Touch Vaginal Laser, which is a laser, and it fires tiny little laser beams into the tissue, creating just enough damage to kind of trick the tissue into clicking into a reparative process. So you get new vascularity, you get new collagen, elastin, other ground substances, and moisture in the tissue with MonaLisa Touch Vaginal Laser. Now, vaginal laser is easy. It's relatively painless. It takes about 7 minutes to completely treat the whole surface area of the vagina. And then we also have another instrument that treats the outside, because many women have pain with entry. We call it with entry. So we want to make sure we treat the outside and the inside. And if you look at microscopic slides of a before and after MonaLisa Touch Vaginal Laser, you'll see the vaginal epithelium is very, very thin. And then after the laser, even after the first session, we usually do 3 sessions in a row, 6 weeks apart. But even after the first session of MonaLisa Touch Vaginal Laser, you can see the thickness of the vaginal epithelium, and you can see that the surface is much more rugated or kind of wavy. So that allows the vagina to become much more elastic. So MonaLisa Touch Vaginal Laser is quick, it's painless, and it's very effective. We start with a 3-treatment series, 6 weeks apart, 3 treatments, 6 weeks apart, and then because the processes that cause the stenosis or dryness of the vagina keep on going, we want to suggest a booster about once every 9 months or a year. So MonaLisa Touch Vaginal Laser has been a huge breakthrough and has been very much appreciated by women, particularly women who want to continue their sex life, but they've had breast cancer, they have a clotting abnormality that prevents them from using estrogen. And these women find that intercourse is much, much more comfortable, and they're much more likely to want to have intercourse with their partner if it's more comfortable, obviously. So talk to your doctor about MonaLisa Touch Vaginal Laser. Very effective, huge breakthrough, and it really has changed the landscape of what us gynecologists can do about patients with vaginal dryness. Thank you.